Welcome to Tech Talks. I'm Holly Scott. Today I have the pleasure of having with me JR Finkelmeier, the CEO of Pacemate. Welcome, JR.
Thanks, Holly. I'm thrilled to be here. I joined Pacemate back in 2024 as the CCO, and now I'm stepping into the CEO role, and it's an exciting next chapter. So excited to be here and lucky to be leading the team.
It's an incredible time, and yes, first and foremost, congratulations. I love hearing
Thank
those
you.
stories of growth within an organization. As the company grows, your career grows. Great
Yeah.
stuff.
Thank you. Thank you. It's a smart, mission-driven team. I'm excited to be here. So
Yeah, we've been impressed with everyone we've known so far. So this is great. Well, before
yeah.
we jump into what makes Pacemate special, I'd love to, hear a little bit more about your career road because it has been quite interesting, especially kind of going back to your entrepreneurial roots. You started outside of medtech, correct?
I think you're referring to American Schoolwear.
Yes. What is? Tell us. Do tell. Spill the tea. Spill the tea.
Wow, you've really gone deep in the resume there, Holly. I haven't talked about American Schoolwear in years. It's interesting. So after college, I grew up in Ohio and then went to school in the state of Indiana. And after college, I took a job in Kansas City and didn't know a soul when I moved out there. And so to try and get to know people, I went to a Notre Dame alumni breakfast to meet some people. And within about 10 minutes, I connected with a gentleman who was same age as me, and he introduced himself as the president of the organization. And about 15 minutes later, I found myself running the Young Alumni organization after this first breakfast. But that guy it turned out to be a very good personal friend. We were in each other's weddings. I met my wife when I was with him, but his dad was a very successful uh, ran a very successful corporate apparel business in Kansas City, and later in his career had started up a business running screen print and embroidery out of a prison of all places. And I always talk about those days. It was social enterprise before the term I think ever existed, but um, they employed hundreds of prisoners that provided true variable labor, and they paid the state for the room and board of the prisoner. They paid into a victims relief fund, and they actually gave the remaining balance to the prisoner to use either in the commissary to put into a bank account so that when they left, they would have a starting point. And so that gentleman was also an entrepreneur and a mentor. And late in his career, he wanted to mentor young individuals that wanted to be entrepreneurs. And the only ask was that you started a business that would leverage the assets and the business that he had started in this prison. And so I had first started a company called American Worksource, and it was focused on delivering corporate apparel to workers and general contractors that couldn't afford to buy the heavy piece counts at the time. And one of the customers I was working with connected me with his wife, and turned out the wife was uh, a Catholic grade school principal. And when I met with her, they were in need of some sweatshirts for a PTO event. And when I looked around, I saw hundreds of kids all walking in the same white polos and khaki pants. And the idea really was born there. And I quickly pivoted from workwear to schoolwear, and I leveraged building kind of one piece spirit wear, but bringing volume in with the school uniform. So it was an interesting time. So
Wow, what fascinating lessons to have learned early in your career. I'm curious, did any of those best practices, business practices, follow you into a leader within the medtech industry?
they did, so if I think back at that, I was a one-man show, and that was kind of the model. It's get uh, light and bright people that wanted to start their own business, give them the financial backing. But I'll tell you what I learned, and that was a journey that lasted about 2 years. It's one thing to build a business that is servicing dozens of customers. It's a completely different universe when you try and translate and scale to thousands of customers. And we never got there with American Schoolwear. But as I went back into the healthcare space, that was really my focus, and that's the lesson I take it today, and really that's where I'm at with Pacemate is how do you go from dozens and hundreds of customers to thousands of customers and millions of patients. So
Hmm.
exciting time. I I'm glad I didn't have on my resume while I was there. I started with the buddy that I was talking about. We actually started a side hustle and built a speed dating business, and I'm super glad I didn't have that on the resume because you probably would have drilled on that as well. So
All right, that's for next podcast because that
yeah,
sounds. I mean, between prisons and speed dating, that's definitely going to carry us more than an hour here.
yeah.
Well, that's fascinating. So, what was your leap into the med tech sector or into medical device? Where was that big break?
Yeah, so so my first job before I did American School, where I started in the pharma space, and that's what brought me to Kansas City. And I loved healthcare, and pharma brings an amazing rigor and training to an individual. But really, the whole time I was there, the where you wanted to be was in medical device. And so after American School, where I decided I was going to go back into healthcare. I wanted a business that could scale. American Schoolware was it was a fun project, but I wanted a business, and so I went to a startup in cardiac monitoring, and honestly, like you just have to get lucky sometimes. The timing was just right. There was ambulatory cardiac monitoring, these devices that would go on patients, and they would wear them anywhere from 24 hours to 30 days, and Medicare had just come out with new requirements making the monitoring on these devices 24/7. And they used to be provided out of cardiology practices. Cardiology practices couldn't manage a 24/7 business. They just weren't built that way. And so service providers got started in supporting this. And I went to go work for a startup that was building a service business around this, and we quickly scaled to about 80,000 patients annually in about the first 2 years I was there. And there was a company out of Philadelphia that was developing a wireless version of the cardiac monitor. So the cardiac monitor we were using was very antiquated, basic technology. You could transfer the data over a what they call trans-telephonic, and play the data over a phone, normal POTS line. But there's a company out of Philadelphia that was developing a wireless cardiac monitor, and interesting thing about that, it was the first ever wireless medical device, not just in cardiac. It was the first ever wireless device, and so this company in Philadelphia had amazing technology. They had talked Medicare into providing the service at 5 times the average selling price that we were providing our service for, and we got together with this organization. We had all the patients, they had the technology, and we put the two companies together and took it public about a year later, and with about $110 million run rate, and it was a wild ride. And after that, we acquired I think 7 companies in roll-ups. We diversified into research and remote patient monitoring, and that's really what became biotelemetry today. So
What an incredible ride in such a short span of time. I know it probably felt like dog years when you were going through it because you had so much going on. How does
it
a company that is the first wireless technology address a fairly archaic, I mean, let's face it, the hospital system, my doctor's office still faxes, right? So they're just
yeah.
way behind the curve on these things. How do we go into a market like that and take it by storm like you did? I mean, that's probably a loaded question, but I'm just curious if there's anything that you reflect on and think, man, if this hadn't happened or that hadn't happened or I hadn't had the tailwinds here, were there forces that played into that?
Yeah, there was about 1,000 breaks that had to go our way, yes. But the reality is when I reflect back on that, um, and I've seen this through my years, there's tons of smart people that build technologies to deliver and to close gaps, deliver solutions. I think the magic happened was I was working for an organization that was focused solely on commercialization and go to market. And the Philadelphia-based company was building a technology and didn't have a channel to get to market. And so when we put those two ingredients in the mixing pot together, we were really just at the right time in the right place. And there was trials and tribulations. We had to develop a CPT code with Medicare. We had to maintain reimbursement. We had to go get reimbursement through commercial providers. So it was not an easy lift, but there was a lot of hard work and scrapping that went along the way. It takes a lot of smart people as well to pull that off, but it was really a fun journey, and I look back very fondly on those days.
Yeah, great lessons that you learned in that biotelemetry days. Tell me what about that? What made it attractive for Philips because it eventually became a Philips company, correct?
Yeah, yeah. So Philips acquired biotelemetry in 2021, and that was it's a really neat story. Philips, and a lot of people don't know this. Philips, today, people think of Philips as the light bulb company or a TV company or a consumer electronics company. Truth be told, they actually divested all of that business years ago. And when they approached biotelemetry, they were operating 100% as a healthcare company. All of the consumer electronics and light bulbs were brand only, and had been divested from the business. But Philips saw healthcare changing, and they saw it going from building widgets and selling widgets and medical devices to selling services, and they really didn't play well in the service space. They operated very well from a device design, manufacturing, and distribution, but just like everywhere else, healthcare was also transitioning into services, and so they wanted to get into monitoring as a service. And um, biotelemetry was a really good fit for that. We manufactured a medical device, but that wasn't the product that we sold to customers. We sold a service, a cardiac monitoring service to customers. That was the product that we sold. And so it was a way for Philips to get into that space. The other thing is Philips really had a long-term vision of owning the patient journey. They wanted to own the journey from the home to the hospital to the in the hospital, and then the hospital to home. And if you looked at Philips's landscape at the time, they dominated in the hospital, and they really didn't participate much from the home to the hospital or the hospital to home. And biotelemetry, that's exactly what we did. We provided a monitoring service for healthy individuals to find problems to get them into the hospital to get treated. And then for patients, sick patients that are already in the hospital getting an ablation or had a cryptogenic stroke, they would leave on our monitors, and we would continue to monitor them on discharge. So we filled two voids for Philips in that process, and so it was a good fit for them.
So did you stay on with Philips after the
I
acquisition?
I did. So after a biotelemetry got acquired, I ended up running the ECG business within Philips for a couple of years, and that was a true honor. It was, you always, I always said I never wanted to work for a big company, and I really didn't know what that meant. I did after 2 years, and it's all in fondness. They really taught me how to operationalize at scale, do things with rigor, and so I ran that business for a couple of years before I ended up joining Pacemate.
Fin- It's fascinating to me because the ECG space, from where I sit, being more on the entrepreneurial company side, it seems like the last 5, 10 years, it's all been chasing the ECG signals. There's just been so
Yeah.
much about that. It's just such a robust market, which can actually make it confusing and crowded, depending on where you're sitting from. So I love your vantage point, and I am curious on what drew you then to Pacemate.
Pacemate's an awesome company. My I'm gonna say my fascination with Pacemate started when I was actually at Philips. So when I was running the ECG business within Philips, we a couple divisions reported up into me. The primary was our ambulatory monitoring. It was a couple $100 million business. We actually ran a competitive business to Pacemate, and it was a very small division, and we weren't operating it well. It was not our focus. We our commercial focus is on the patch monitors, where we were generating very high margin and revenue for the organization. And I used to sit around in management meetings when we would talk about this implantable device division that competed with Pacemate, and I would say there's companies like Pacemate that are sitting in WeWork spaces spending 20 hours a day thinking about how to optimize cardiac workflow for physicians, and here we are doing it, 10% of the time and 10% of the focus. And there was just no way to compete with a company like Pacemate at Philips. And Philips has since actually divested that business, but I admired Pacemate, and really, not only because they were optimizing the cardiac workflow and making it efficient for doctors. They had figured out. I use this term. I steal it from Amazon, but they had really kind of figured out the last mile delivery of cardiac data, and it was not only were they doing it and beating us in the implantable market, but they were actually creating quite a threat for us in our ambulatory space at Philips as well, because they were disintermediating us from the end user. They were actually taking our patch monitor data. We were doing all the heavy lifting at Philips, and they were integrating it into Pacemate, and then providing it to the doctor in the standard workflow that they were providing the doctor all the other cardiac data endpoints. And so um, we became a very commoditized market, and Pacemate became a very sticky solution. So it was a company that I had admired from a distance, looked at as a competitive threat. And when I got a call from a recruiter and they were looking for a CCO, it was just it was a good time, a good place. They had amazing product market fit. Um, it was a company the size that I had been used to operating in, and they just truly admired what they were doing from a physician workflow standpoint.
I love your visual. You know, the Amazon. They are, of course, the pinnacle from a distribution and just globalization perspective, right? And then you think about the last mile. That can be everything in medicine. That can be everything in medicine. I'd love to just unpack that a bit more. What do you think makes Pacemate so much better at this distribution, at access, at getting, at improving workflow than other solutions?
Pacemate is truly fanatically focused on optimizing physician workflow. And if you think about the tailwinds that help our business and where the space is at, um, it doesn't matter what area of healthcare you're talking about. You constantly are reading about staff shortages, and burnout's real, and providers need tools that will help them make work smarter. And at Pacemate, we always talk about letting clinicians operate at the top of their license and not be buried in admin. And that's really what Pacemate has done so well. Is we have taken a technology to simplify physician workflow, so that they can live in one spot. Um, we are What separates us is the level of sophistication that we put within our EMR integrations. And why is that important? It's one thing to take data from a medical device and put it into an EMR. It's another thing to enrich the data on the way in so that the provider has all the contextual information that they have. So when we integrate with customers at Pacemate, it's not just providing results into an EMR. It's a bidirectional pull out of the EMR so that we can provide that contextual data to the physician while they're reading. And so um, the other thing that separates us is really our clinical grounding, and I think that's such an important thing as you watch. We're here on Tech Talks, but I'm going to talk about something that's so fundamental to healthcare, which is um, it's putting smart sensors in to collect data. It's putting automation in the middle of it, but that one important ingredient that always needs to be there is subject matter experts that are always in the middle of it. And so, if you look at Pacemate, we build a technology that is seamless for the providers. We put automation in the middle of it to simplify, and then we've put subject matter experts that are clinically grounded, that are really driving the actual insights that the physicians and healthcare providers use to manage the patient outcomes. So it's that mix of technology plus automation plus subject matter experts that really separates Pacemate today.
It's interesting too because it kind of brings me back to the comment you made about what Philips wasn't doing that Pacemate was doing, more that relentless focus to true workflow improvement, you know,
Yeah.
from the actual physician on in, as well as the patient experience. Is it an agnostic platform? Is it one that you can use any devices, whether it's a Medtronic device or an Abbott, or does it matter?
No. So, so today, cardiac's our core, it's our deepest domain. So we have all implantable cardiac devices on the platform. We have all of the major external monitors on our platform, our cardiac external monitors on our platform. Um, we even bring in some consumer ECG, and that's really becoming more and more important. You see that in healthcare today as these consumer devices that are collecting actually really good information and data. It's just what do you do with that data deluge? And that's constantly taxing healthcare providers today. But we are absolutely agnostic. Today, it's primarily in the cardiac space, but if you go back to my comments about smart sensors and automation and clinical oversight, that's not a that has nothing to do with cardiac. I mean, we will, if you look out into pacemaker future, while it's cardiac focused today, on an agnostic basis, that recipe really works for anything within healthcare. So
That's incredible. And maybe just to zoom out for the audience, depending on where they're coming in and listening, the idea of remote monitoring, the idea of cardiac remote monitoring, we can start there. It, it's fairly standard practice now that if you get a pacemaker, you're going to be monitored. Is that indeed correct? Is this something that every patient goes home with a monitor who has some kind of implant, either a defib or a pacing system?
yeah, I mean, there's always exceptions to the rule, but best practice is every patient that gets an implantable device is going to go on a remote monitoring schedule. And so, these devices are super sophisticated. They not only are delivering therapy, but they're also delivering diagnostics along the way. And so we play a vital role. That's just the amount of information that's coming off the devices is overwhelming for healthcare providers today. And so we put both automation from an AI standpoint as well as subject matter experts in the middle of that to pare that down into true actionable insights for physicians. Because the reality is, every patient that's getting an implanted device, and that's more and more every day, are going to go on a remote monitoring schedule, and so someone has to watch and monitor.
Yeah, and it's been a real boom in the last 10 years in terms of investment dollars going into this space from a management perspective, optimizing the process, optimizing workflow, and then also on the devices themselves. How can we make that experience more user friendly? How can we make that a less intrusive or less cumbersome patient experience and data point as well? So there's lots about that market that's really ripe. And when we have conversations with individuals like you talking about the technology, I remind people that careers are built on building out markets. And when you have a
Yeah,
market that is high growth and expected to, as we anticipate remote monitoring and cardiac remote monitoring in particular over the next 5 to 10 years, that's where you can really make a difference. You can drive things like you have from its infancy and then taking it to scale. So whether it's in the hundreds or in the thousands or more, that's the fun stuff. That's the stuff you can look back on and say, boy, that was quite an experience that created quite a platform for you.
yeah, yeah. It is. You think about if you think about healthcare, and you touched on user design, and we do that in our software every day, right? To how do we simplify a provider's life, take out clicks, make it more efficient. A data point that they have to go hunt and peck for, we put right at their fingertips. But user design is so important because it drives compliance. But if you think about from the patient perspective, um, that is the number one thing in healthcare is um, all kinds of amazing technologies, all kinds of amazing service, but if the patient's not using it, um, they're not staying compliant. You're not going to get the outcomes. And so at Pacemate, we do all the innovative things, but we also do the blocking and tackling things like driving patient compliance. We have a whole team of people that put phone calls, whether automated texts or automated phone calls or manual phone calls to patients to make sure are they communicating with their transmitter? Because the reality is, if they're not communicating with a transmitter. It doesn't matter how fancy the software is, um, or the health systems you're working with. If the data is not there, the data is not there. So I think we look at it as a holistic product offering that really drives better outcomes through the technology, the people, and the processes that we put in place. So
Yeah, phenomenal. You've got the holistic way of looking at the ecosystem, yet you have innate focus. You know, you're focused on that. That's you're looking to be the best in that category, and certainly achieving that. And now you, JR, you know, here you are, the CEO, and moving this company forward. What's next? What do you see as the vision for the next, say, 3 years, 5 years, and beyond?
that's a loaded question, Holly. Yeah, I mean, I think I always look at uh, operating a business on two fronts, and it you got to spend 75%. I don't know what the magic formula is, but 75% of your time on performing and 25% on transforming the business. And so, when I look at like where we're taking this business, um, we got to perform today, right? That is goal number one. And what do I mean by that? We got to build this company to operationally scale. And I brought it up when we were talking about American schoolware. You'd said, "Is there a lesson I've learned?" And um, it's hard to take businesses from hundreds to thousands of customers, or hundreds of thousands of patients to millions of patients is. And there's a lot of companies that come into the healthcare space, they win early, but they don't stick around, and it's because they don't know how to operationally scale. So today, the focus from a performance standpoint is we got to keep our eye on the prize. We're constantly bringing in new customers, but we got to do that in an operational and scalable way. And so there's a heavy focus there. The future. There's so much from pace made, and I think there's two areas where we will focus as an organization. One is, how do we take this roadmap that we've built of taking cardiac sensor data, putting automation onto it, putting it through a subject matter experts, and then turning around real efficiency to healthcare providers. How do we do that in other spaces beyond cardiac? I think that's a very obvious focus for Pacemates in the go forward. But probably the biggest opportunity is data, and we are sitting on what is probably the most richest longitudinal cardiac data set in the country. And that's not just from the data that we're taking off the devices. We're also pairing it with a bunch of information that we pull out of the EMR. So it's very contextual, it's longitudinal, and I can't even tell you how much data we have. So that will fuel AI and prediction and proactive care that's really hitting healthcare today. And so I think if you look out 5 years and you say, where will Pacemate be? It's certainly going to be beyond cardiac, and it's certainly going to be leveraging the data that we've been building over the years along the way. So
Just thinking about that, you're just creating my vision. There's so much potential in neuro, and then I'm seeing opportunities for partnerships from other device service providers, as you've seen in your early days of biotelemetry. We're seeing that more frequently in the medical device industry now that tech does have such an influence. And I think Pacemake is just an incredible example of the possibilities and what could be done in medicine. So we're really thankful for your hard work, JR. Thank you so much for sharing so much with us today.
absolutely, absolutely, Holly. I really appreciate the time today, and this was fun. So thank you for inviting me on to Tech Talks.
Absolutely. And to the audience, thank you for listening. We'll see you next time.